and welcome back to MedSynapse podcast series, where we bring you insightful conversation with leading experts in medical field. And today we are going beyond the operation theater to explore what really happens after the total knee replacement. Joining us today is someone who has seen these transformational changes in first-hand experience, is Dr. Srinivas Thati. Dr. Srinivas Thati is orthopedic surgeon with experience in advanced hip and knee joint replacement surgery with computer navigation, patient-specific cartilage regenerative surgery in early arthritis, also in sports surgery in Medics Hospital. Welcome, Dr. Srinivas, to the podcast. We're excited to have you here.
Hi, thank you for having me. So I not only work in medics, I'm the director and head of the department at AG Hospitals, Gachibowli in Hyderabad. So I start off doing with the robotic replacements as well here. That's the most advanced at the moment. Certainly, knee replacements is a big kind of a commonest problem in our country, not only in our country, entire world. Knee arthritis is a very common issue. And certainly in end-stage arthritis, where the joint is completely worn out, knee replacement is the treatment of choice.
So, welcome Dr. Srinivas to the podcast. Without further ado, we'll start with our first question. Let's start by stepping into the patient's shoes for a moment. In your clinical experience, what are the most significant lifestyle improvements patients typically report in 6 to 12 months for a successful total knee replacement surgeries?
In end-stage arthritis, the patients usually come with significant pain in the knee, which can limit their walking distance quite a bit. Even for some patients, coming out of the bed or raising out of the sitting position can be very difficult. So their overall lifetime, the normal day-to-day activities will be very much impacted. After the knee replacement surgery, particularly when we're doing the robotic surgery, we can see the patients getting back to their routine activities a bit more quicker. The recovery is a bit smoother. The patients' pain immediately after the surgery may be there for a couple of weeks. After that, with every day, their pain will be improved and their mobility will increase. So the first difference you see after a knee replacement surgery is the pain which they have during their day-to-day activities will be resolved to completely, I would say 95% of the pain will go away. Once the pain is reduced, their ability to do their day-to-day activities, like coming out of the bed, getting out of the chair, walking for a short distance, all this will become much easier for them. And as the days pass by, I would say 4 weeks after surgery, majority of them will be able to do their day-to-day activities. They would not need any of the support in their activities. By 6 months' time, I would expect most of the patients to go for a long walk. Easily they can walk around 4 or 5 kilometers. They should be able to do the stair climbing, which would be very difficult before the surgery. And they can go on a travel journey. Usually journey they can start after 3 months itself. But by 6 months to 12 months, they can be going to anywhere like any other person. A lot of them have limitations in hiking before the surgery. But once the surgery is done, I have seen a lot of my patients who can go for places like temples or any of these worshipping areas as well. So a lot of them will have very good improvement when it comes to their pain, the movement, walking, and also everything together. Their lifestyle is also significantly improved.
Okay, and that's incredible to hear. So let's move on to the next question. We know that not every patient is the same and expectations can vary from patient to patient. So how do you approach the conversations around realistic goals like returning to sports, traveling, or physical demanding jobs after surgeries?
That's a very good question because unrealistic expectations is the commonest issue with the knee replacement. Sometimes patients think that they can do like a 30-year-old, that which is not possible. So, but setting the scene correctly to tell them what to expect after the surgery, how much they can do, and what are the limitations, plays a crucial role in decision making on surgery and also the outcome. So majority of the patients after the knee replacements, they should be able to do all their day-to-day activities without any limitation. But when the patient comes to me, the initial counseling at the time of initial consult for surgery, I would ensure that I would understand what are their main problems. Some patients may have pain is the only limitation, but for some patients, it can be the deformity, it can be the mechanical symptoms like locking or giving way of the knee, or having difficulty in sleeping because of the pain. So all of these can be taken into consideration, and I would then tell them what to expect in certain particular timeline. So what would happen in first 2 weeks or so, the next 4 weeks, how we are going to do, then in the next 6 months or so, how we can improve the activities. So when they know these timelines, it makes their expectations more realistic. And a lot of the patients can have certain amount of complications which are very limited, which will not have long-term impact on the joint replacement, like swelling is very common, and majority of the patients can have swelling of the joint and the leg as well for 6 weeks to 3 months. Usually when they wake up in the morning after a night's sleep, the swelling will be going away. That is mainly dependent edema, because of the swelling is mainly because of the dependent edema. Sleep is one thing which patients can be affected with. Majority of the patients, not only replacement surgery, any surgery, they'll have disturbed sleep for around 6 weeks because of the pain. But after 6 weeks to 8 weeks, their sleep will get back to normal. Knowing that, the patients can get adjusted to that sleep pattern as well. And they should definitely avoid sleeping in the daytime so that won't impact their night sleep. Walking wise, walking with support for a week or two. With the robotics, because our soft tissue balance in the joint is very good, the stability is very good, they can start walking without a support within a week time. And most of them, as I said, can walk independently by 4 weeks time. Physical activities, apart from walking, they can start cycling, they can start swimming, they can do rowing machine, they can use a cross trainer. All of these can be done from 4 weeks on. And after 6 weeks or so, if they want to do any journeys, long journeys, after 6 weeks is absolutely fine. So I would definitely take time to explain all this to the patient so that they have a realistic timeline on their improvement. That makes a huge impact on their overall outcome.
Okay, thank you for addressing the different timelines for patient needs and requirements. So we'll move on to the next question. Is we often talk about bones and biomechanics, but there is another side to it, like the emotional journey of the patient. So what happens and what have you observed in terms of psychological or emotional changes in patients after knee replacement, especially when it comes to the sense of independent and overall quality of life?
Certainly, right. It's a huge relief for a lot of patients because they don't have to depend on for their day-to-day activities, particularly those who have end-stage arthritis. And see again, all how their lifestyle is impacted depends upon the age of the patient, the severity of arthritis, the deformity and stiffness they have. If the patient is younger with even severe pain, their recovery will be quicker. And if the patient is an elderly who has a significant deformity and who is already been dependent on for his activities or her activities, and they lose a lot of muscle as well, so there will be a lot of muscle weakness. All these can limit their activities significantly. And some patients will be emotionally disturbed as well. Mentally, some will be very anxious with the expectations of pain post-operatively. But when you actually look at the pain which they get post-operatively, a lot of the patients, their pain is not as bad as they usually have pre-operatively, which is associated with activities. And some patients can have depression, but patients who have anxiety and depression before surgery, their risk of having more anxiety and depression after surgery will be more. So it is very important to address this issue. A good counseling of the patient, taking good time with the patient so that they understand that this surgery is mainly for improving their pain, their mobility, and their independence. A lot of them will welcome that. I do see a lot of elderly patients coming back and thanking us because they have improved so much. They're able to do their physical activities. They're even the outdoor activities also. They'll be able to do independently. And a lot of the men, particularly, they can start driving themselves after 4 weeks. So that's a huge relief of pain and the mobility, right, for the patient. So yes, it makes a good difference. And emotionally, the patients may be disturbed in the beginning because of the pain, because of the anxiety of what is going to happen. But a lot of them, I would say more than 95% of the patients will be very happy post surgery. I don't see anything like anxiety or depression in our patient population at all.
Okay. So, Dr. Srinivas, from your perspective, what specific lifestyle changes or rehab strategies have you found most effective in helping patients maintaining their result long term?
That's a very good question, because it is not just the surgery. And after a knee replacement, it is how long the joint lasts. So if you look at the survival of the implant when we do a knee replacement, majority of them, irrespective of the company implant which we are used, okay, a lot of studies show that they last around 20 years. 90% and above can last for 20 years. And patients who have obesity, that means body mass index is more than 30 or 35, these are the patient groups where the failure rate can be a bit early. So it's very important for the patients to understand this bit. Majority of the times, osteoarthritis in the joints will limit the mobility of the patient. This can cause not only stiffness in the joint, it will weaken the muscles, it will increase the weight of the patient. There's a big burden of obesity. And with these factors in mind, it's very important for the patient to start the early rehab. I usually advise all my patients to try and see if they can lose some weight before they come for surgery. If it is not possible, they need to do in a proper way, go to a bariatric team to identify. It doesn't have to be surgery. There are so many different ways of losing weight. Discipline is very important. Okay, if they can do that and they can maintain their diet pattern, do limited activities, what they can do, that will help them in losing a bit of weight. If they're not able to lose weight, then definitely we have to go for surgery. That's number one. The second thing is the prehab physiotherapy. I always recommend all of my patients to have few sessions of prehab physiotherapy. This is basically to improve their muscle strength so that more muscle is activated, which will help in their post-operative exercises and recovery. So prehab physiotherapy is very important, and they need to understand the surgery itself and what to expect. If they know what to expect, their limitations will be a bit less. They can adapt better post-surgery. So initially, these few things are very important before they head into surgery. After they go into surgery, I recommend all of my patients to start to mobilize from the day of surgery itself. Our physios will make them sit, make them start fully weight bearing on the day one of surgery itself. And I would allow them to get rid of the supports as soon as they are able to walk independently, because that allows the muscles to recruit early. And certainly, majority of the patients lose weight in the first few weeks after surgery. They have to maintain that weight loss so that will help them in the long run. All of the patients should not only do physiotherapy in the initial 3-4 weeks after surgery, but as a routine, they have to make it a habit to regularly exercise. That will maintain their muscle mass, that will maintain the movements of the joint, that will reduce the wear out in the joint. Hence, the longevity of the implant will be increased. So these are the things which all of the patient has to do.
Okay, that was a really well put together answer. So we'll wrap up our session with one last question is your work with a diverse range of patients. So how do you see knee replacement outcomes and the lifestyle impact varying across different demographic groups?
Well, that's a very interesting question. See, the outlook of the patient is very important, and certainly where they come from, like rural population, will be different from urban population. Those who had exposure to different healthcare facilities, their outlook will be very different. So when I compare my experience in UK, US, and here, I don't see much of a difference culturally. Okay, as a patient in terms of patient recovery, a well-informed patient anywhere in the world, they do pretty well. So for me, that is a very important aspect. All the patients should be counseled well before surgery, what their expectations, how the things, what they can do, what they can't do. So in our country, more than traveling, our population likes to go for pilgrimage and all that. And most of them, after 3 to 6 months of time, they are able to do those. Outcomes wise, I don't see big difference depending on the demography. But when you look at the recovery of different genders, male and female, the males usually recover quicker compared to females. Patients who are less obese will recover quickly than those who are more obese. Patients who have very bad arthritis and their mobility is less in the before the surgery, they will take a bit longer to recover. So optimal timing of surgery is very important. If the patients wait for too long before having a replacement, they may take a bit longer to recover. But when the surgery is done in the optimal time period where the muscle is not wasted much, they usually recover very quickly compared to the other patient groups. And younger patients, certainly they are more common. You can see them getting back to their normal life quicker than the elderly. And patients who have more comorbidities, they take longer. Patients who have inflammatory conditions may take a little bit longer for recovery than those who doesn't have. So there are a number of factors which can affect how the patient's recovery is, not only the demographics or cultural characteristics. And we should remember that no two patients are similar. One of the common issue in our country is the patient says that person who had the surgery has recovered very quickly. I'm taking too long. Why is that? No, don't have to worry about that. Every person has their own timeline because there are a number of factors which will affect their recovery. So very important to talk to the surgeon who has done the surgery and understand why there is any delay in the recovery and what are the things they can do to help their recovery quicker. But knee replacement is a very good surgery which has shown that the outcomes are very good and the quality of the life of the patient is improved significantly. The other important interesting factor is not only the quality of life, it is also cost effective. There are a lot of studies done in US on cost effectiveness of knee replacement, and majority of the patients, the quality adjusted life years can be up to $200,000. That is the cost effectiveness of a knee replacement.
Okay, thank you so much, Dr. Srinivas, for joining us today. It was a really enlightening conversation with you. You have painted a picture beyond surgeries and told the audience about the complete picture of the surgery and beyond how it will be helpful after the surgery. So, thank you so much for joining in.
Thank you. Thank you very much for inviting me for this talk.
And thank you to our viewers for tuning in. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join our MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy, take care.